Hello everyone. So since we launched our new treatment, Sculptra, we've been getting a lot of questions. So I was like, let me do a video and explain it all. So first off, what is Sculptra? Sculptra is PLLA, so polyl lactic acid. It is a powder, and I mix it with water, and then I inject it into the face. So with Sculptra, it's a biostimulator. It makes your own body build its own collagen. It's not like filler. I'm not giving it immediate volume. I'm giving it tools to help your body produce its own collagen, to rejuvenate the tissue naturally. With Sculptra, I don't like to say, oh, I'm just going to treat the cheeks. I'm just going to treat this line. I like to treat globally to rejuvenate the face as a whole, to give you a more rested, natural look, as opposed to just singling out a single area. So some places that we don't inject Sculptra is underneath the eye, above the lip, and in the lips itself. But typically, I'm replacing volume in the cheeks. Back here, this is called your preauricular area. I'm replacing a little bit of volume right here to tack things back. The angle of our jawline we can do as well. These little smile lines we can do. These marionette lines, so the corner of the mouth down. A pre-jowl sulcus, so whenever we pinch our chin right here, it causes that little divot because we're starting to lose some volume. I'll replace a little bit right there too. So that's my normal spots for this. You can also do chin as well to kind of rejuvenate as a whole. Oh, temples. I forgot temples too. So if you look at your face and it's starting to hollow at the temples, it's not nice, but we call it like a peanut shape that you're starting to get because the cheeks are poking out. Then it's super hollow right here and super hollow right here. We can put some Sculptra in that area to rejuvenate the face as well. So it's a powder and a water. I mix it together and then I inject it in the face. Usually I'm using cannula. So what does that mean? That is a blunt tip needle. So I'm not going in and out 8 million times with needles. I usually do about 2 entry points and I can treat the whole face. I'm fanning in little circles under the skin with a blunt tip needle. So a lot of people's been asking what's downtime. With it, right after we inject, I mix the powder with the water, so you will be a little bit fuller. Most patients, they love it. They look hydrated, they look glowy. They're like, can this stay forever? Usually they like it right after. Now, my entry points, I usually use a little bit of lidocaine with epinephrine to make the little poke holes that I use to go under the skin with the cannula nice and numb. So usually you have a little white circle around where my entry points are, probably about 2, maybe 3 per side. That usually goes away in about an hour. And then it is a poke, so you can have a little bit of bruising. I try my best to avoid that, but anytime I introduce a needle to the skin, there's a risk that you can have a bruise there. You also are a little bit sore because I'm going under the tissue with that cannula and I'm manipulating the tissue, so that can make you a little bit sore. Totally normal. So what to expect result-wise after? So for about 3 days after, you're still glowy, bright, everything's looking great, and then it goes back to baseline because that water that I mixed this Sculptra with just kind of dissipates into the tissue, and you're like, Candice, you messed up? What you did? No, totally normal, totally expected. The little Sculptra particles travels to your collagen and says, hey body, start producing your own collagen. So then we start to get rejuvenated naturally from within. Those little collagen particles that's deep in our skin, it lives in that dermal layer. So I'm trying to say, hey, come back alive. So I'm using the Sculptra to make it come back alive. But it takes time. You don't start seeing results till about 6 weeks. And that's not even, let's say you wake up 6 weeks from your treatment. It's not like, oh my God, everything's perfect. No, that's your first signs of it. And then it keeps building over the next few months. How much do I need? Because that's been a common question as well. A rough rule of thumb is you need 1 vial per decade of life. So if you're 40 years old, you may need 4 vials of Sculptra. Do I inject 4 vials of Sculptra at once? No. Usually the most I'm injecting is about 2 if I'm just targeting face. We can also do this on the neck as well. That usually takes about a vial itself. But everybody's different. You know, some 40-year-olds or 50-year-olds look very, very old. And then the next person you talk to, they're 60 years old and they look phenomenal. So everybody's going to be completely different. That's the whole point of having a consultation, to where I can customize you, give you a solid game plan. Look, this is how much you're going to need, and come up with a future plan. So I have to just rough it for y'all if I'm giving generic advice. So 1 vial per decade of life, roughly. After age 25, you start losing collagen every single year. So by age 40, you actually lost 25% of your collagen. Like, what? It's crazy. So this is going to help turn back time a little bit and rejuvenate the face as a whole. So once we get to where we're restored and we're looking and feeling our best, how do we maintain this? Usually about 1 vial per year to maintain the results. So it's a little bit upfront work and an upfront investment as well. But once you get to your goal, you need just a little bit to maintain it. You also will never look filled or overdone because you're treating the face as a whole, and it's not fake product. It's your body's own stuff. It's your body's own collagen. How long do results last? Up to 2 years, even some cases 3 years. So yes, I'm saying I need 1 vial a year to maintain your results, but guess what? You're not going to baseline and I'm building it all back up. I'm just topping you off. So about 1 vial a year per maintenance. Right now we have an intro pricing of $900 per vial. So I don't want you to stress about how much you need. I want you to come in for a consultation and let me customize it for you. Another issue with Sculptra is you want, I always say, a collagen blanket. You don't want to develop little balls. So after we inject the Sculptra, the rules are 5-5-5. You massage for 5 minutes, 5 times a day for 5 days. So anywhere that I inject, you massage to where that collagen just lays nice and bright over the whole skin. It's not forming little tiny balls. So 5-5-5 is that rule for your post-care instructions. But a lot of times the patient's skin texture also looks really, really good. They call it the Sculptra glow after because you're just rejuvenating the skin. Another common spot, whenever patients smile, sometimes they have these little bitty baby wrinkles right there, and that is a B to deal with. Sculptra is really, really good for that. So I hope this helps answer some of your questions. We kind of covered downtime, prices, longevity, what to expect from it. The treatment itself is pretty comfortable too because I numb my entry points and then I'm just fanning under the skin. When I reconstitute this product, so whenever I mix it, because obviously I can't inject powder into your face, whenever I mix it, I add lidocaine so it numbs as we go too. So this is Sculptra, guys. If you're interested, just let us know and we will get you on the books. We'll book you for that Sculptra appointment and then I'll customize exactly what you need and give you exact price quotes in that consultation. So hope this helps.